Hello and welcome. Today we're diving into a crucial topic in neurology, ureterovesical obstruction or UVJO. This condition affects the point where the ureter, the tube carrying urine from the kidney, meets the bladder. Join us as we explore the causes, symptoms, diagnosis, and treatment options for this potentially serious urinary system issue. What causes UVJO? The etiology is often congenital, meaning it's present at birth. In these cases, it's usually due to abnormalities in the development of the ureterovesical junction itself. This might involve narrowing of the ureter, an abnormal valve-like structure, or a lack of muscle support around the junction. However, UVJO can also be acquired later in life. Acquired causes include scarring from previous surgeries, inflammation, or even tumors pressing on the ureter. Let's understand what's happening inside the body. The pathophysiology of UVJO revolves around a blockage at the ureterovesical junction. This obstruction impedes the normal flow of urine from the kidney to the bladder. As urine backs up, it causes hydroureter, a swelling of the ureter, and hydronephrosis, a swelling of the kidney. This back pressure can damage the kidney over time, potentially leading to reduced kidney function or even kidney failure if left untreated. How common is UVJO? The epidemiology of UVJO varies depending on the population and the specific cause. Congenital UVJO is relatively rare, affecting approximately 1 in 2,000 live births. Acquired UVJO is more difficult to quantify as it can be a result of various underlying conditions. Certain populations may be at higher risk depending on access to prenatal care and the prevalence of other urinary conditions. What are the telltale signs? The symptoms of UVJO can be subtle or severe depending on the degree and duration of the obstruction. Common symptoms include flank pain, which is pain in the side or back, urinary tract infections, or UTIs, and blood in the urine, known as hematuria. In children, UVJO may present with failure to thrive, poor feeding, or persistent unexplained fever. Some individuals might not experience any noticeable symptoms until kidney damage is significant. How do doctors find out about UVJO? Diagnosing UVJO typically involves a combination of imaging and functional tests, and ultrasound is often the first step, allowing visualization of the kidneys and ureters for signs of hydronephrosis and hydroureter. Avoiding cystoarthrogram, or VCUG, can help identify any reflux of urine back into the ureters. A nuclear medicine renal scan assesses kidney function and drainage. In some cases, a cystoscopy, where a small camera is inserted into the bladder, may be performed to directly visualize the ureterovesical junction. UVJO can be broadly classified based on its cause, congenital or acquired, as we've already discussed. It can also be categorized by the severity of the obstruction, ranging from mild to severe. The type and severity influence the treatment approach. What are the treatment options? The primary goal of treatment is to relieve the obstruction and restore normal urine flow, thereby preventing further kidney damage. Mild UVJO may be managed conservatively with observation and monitoring for any worsening of symptoms or kidney function. More severe cases often require surgical intervention. Options include ureteroneocystostomy, where the ureter is reimplanted into the bladder at a new location, or endoscopic procedures to widen the ureterovesical junction. The choice of treatment depends on the patient's age, the underlying cause of the obstruction, and the overall health of the patient. Can UVJO be prevented? Prevention of congenital UVJO isn't possible as it's a birth defect. However, minimizing the risk of acquired UVJO involves managing underlying conditions such as kidney stones, preventing urinary tract infections, and avoiding unnecessary surgical procedures in the pelvic region. Regular check-ups with a urologist can help detect and address any potential issues early on. What's the outlook for someone with UVJO? The prognosis for UVJO is generally good, especially when diagnosed and treated early. With timely intervention, kidney function can be preserved and symptoms can be alleviated. Recent research focuses on less invasive surgical techniques and improved understanding of the genetic factors contributing to congenital UVJO. These advances aim to improve outcomes and reduce the long-term impact of this condition. Thank you for joining us on this informative journey into the world of ureterovesical junction obstruction.